submit written testimony, so I'm going to try to just give an overview on some key points. I'm an attorney in Ocean County. I'm also the executive director for the NORML-NJ, the National Organization for the Reform of Marijuana Laws. I'm on our national legal committee. We meet twice a year, and we communicate daily to discuss marijuana policy in this country. So we have a lot of information to offer. This is really a political game right now, and patients are dying while this game is being played at the direction of Governor Christie. I've attached to my testimony a letter from Bob Van Zandt, who is a cancer patient, desperate to be a participant in the program, who has since passed away. And he's just one of many patients that are dying while we continue debating over this bill. The regulations, I would say, in my opinion, are set forth in bad faith in Governor Christie's point in blocking the program. One of those things, they put online the proposed regulations, the new set, and the publication date in the New Jersey Register is February 22nd. They simultaneously posted online the RFA, which has a deadline of February 14th. So now I have countless applicants calling me saying, what do we do? What do we do? There's this deadline of February 14th. To which the regulations themselves say the RFA is going to be published in the New Jersey Register, which isn't going to happen until February 22nd. So these applicants are scrambling to lease properties, put contracts on properties, and put out money to show, pursuant to the regs, they're in compliance with zoning. And it's a great expense. It's not a game to these ATC applicants, and I'm a consultant to many of them. There's a lot of money, a lot of financial risk, and they're working very hard to participate. I want to set forth a few things that you may or may not know. We're always compared to California and Colorado. Colorado has over 800 medical marijuana centers. They are now licensed. California has over 1,000. So if we look at Colorado, for example, they have now 95,477 registered patients. If we apply the limited qualifying medical conditions that we have in New Jersey to that same pool of patients, only 5,742 of those patients qualify. So when the department is saying, we're going to have this big program, we need all these safeguards, there's going to be so many people, there are not going to be a lot of patients registering for the program just because of the limited qualifying medical conditions that we have. So they propose in their economic impact statement, the department, a $2.5 million budget with nuances that are to the level of absolutely ridiculous. And I just want to point out some of those. The physician registry, these are already licensed physicians in the state. There's no reason to continue to monitor them through a program. They want surveillance cameras in the ATC centers with a remote to the state, that patients and employees at these ATC centers are going to be monitored by state employees. That, to me, it rises to the level of communistic. I'm out of time. I don't know if you'll let me continue with this.
As I said, you finish your sentence with another paragraph.
Okay. Just some of our safeguards, we have no home cultivation, a one-on-one relationship with an ATC, no doctor shop, and it must be a treating physician, and we have these limited qualifying conditions. And our main contentions are the level of THC at 10%. The department only used 9 at the University of Mississippi research. Not all of the available research, as Dr. Petro was testifying to. The 3-strain limitation ignores the factors indicas, sativas, and hybrids. So if they're saying there's a high, medium, and a low with a 10% max on THC, they're basically telling patients they have one choice and one choice only. As Dr. Petro testified, some work differently on different conditions.
Any questions? Any questions? Welcome, Senator. I know you come from the